Are you or any of your family member is taking a levothyroxine medicine for your thyroid imbalance? Yes. Do you know what are the side effects of this medicine? If you don't know, then stay tuned with me. We are going to discuss that in our today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. So in the previous video, I spoke about how do you have to take your thyroid medicine in a correct way. I've got lot of good response of this video and I've got many comments. People have asked me all sorts of questions and many of them have asked me, doctor, what are the possible side effects? And that is where we are here today in our today's topic. So we are going to discuss about what are the side effects of this levothyroxine medicine. Now many of you might be taking a levothyroxine medicine and many a time this medicine is for a very long period of time and sometimes it can be even lifelong. And it is very common to have that question that if I'm taking this medicine for years and years, will it damage my kidney? Will it damage my liver? Will I have any other side effects? So that's what we are going to discuss in our today's topic. So the levothyroxine medicine is most of the time prescribed mainly for 2-3 conditions. The first one is a hypothyroidism, also called as an underactive thyroid, also called as a Hashimoto's disease. Second condition is a goiter. Now goiter is nothing but an enlargement of your thyroid gland. And the third condition, that is a certain types of the cancer. So for all of these conditions, many times these patients are prescribed levothyroxine medicine. So let's see what are their side effects. So before I begin, I just want to make you one quick note is that these side effects are most of the time mild and they can be temporary. Only on certain conditions, on certain situations, these side effects can be very profound, they can become very severe and they can be even a life-threatening. So that is what we are going to discuss. Now why these side effects happen? So before we begin that, you must understand the normal thyroid function. Our thyroid gland produces a hormone called as a thyroxine. Now when you have a thyroid which is not working correctly, you have been prescribed a external replacement of this hormone, and this hormone is none other than your levothyroxine. So your levothyroxine is actually a synthetic artificial version of our natural hormone. So these side effects will happen only when you take this medicine in an overdose and more than the requirement. Many times if you take this medicine even without the need of these medicine, then also you can get the side effects. Alright, so let's discuss the side effects. So this medicine basically works by improving or increasing our metabolism. So all the side effects happen, that's because of the hypermetabolic state. So what happens to your brain and your nervous system? So in your brain, the very first change which you might experience is a change in your sleep. Many people experience insomnia where they are not able to sleep properly, or many a times they wake up in the morning or they wake up in the midnight and due to the disturbance in their sleep. Now please understand that waking up in the midnight can be because of many other reasons also. First, if you have, along with the thyroid, if you have a condition called as a obstructive sleep apnea, what we call it as a OSA. Now, obstructive sleep apnea happens more in a people who have a overweight or who are obese. And when they sleep, at that time, they also have a very common habit of snoring. So if that is a condition, then you please speak to your doctor and get obstructive sleep apnea treated. Secondly, thyroid patients have a high risk of a diabetes, and when you have a diabetes, especially when it is uncontrolled, in that situation many a times patient have a symptoms of a midnight urination, and that we call it as a nocturia. So you might be disturbed because of the waking up in the night for a washroom. And a third, especially in older men, they have a prostate problem that can also disturb you for your and midnight sleep. So please make a note of it. Sometimes even your blood sugar goes down, that can also wake you up. So it is difficult to say that your side effects is due to the medicine or it is due to some other condition which is attached. Alright, that's the first change. Second change what you will see in your nervous system is a change in your mood and change in your behavior. Many times people complain that they've got a lot of mood swings. Their mood fluctuates. Sometimes they can have a nervousness, sometimes they can have an irritation and a confusion state also. These all are very common changes in their mood which they experience. Many times even a depressive thoughts is also a side effect. Now it is very difficult to say whether this depression is happening because of the medicine side effect or it is happening because of your thyroid imbalance. Yes, people who have a thyroid problem, they have a high chances of having a depression issue as well. Alright, and so these are the certain mental side effects. Another side effect which commonly people have is a memory impairment. They have a forgetfulness and they keep forgetting. Now again, forgetfulness is also a symptom of a thyroid problem also. So please make sure that you check that your thyroid is optimally controlled or not. Alright. Now let's see the second major side effects which can happen on your heart or your cardiovascular health. So what happens to your heart? Due to the hypermetabolic rate, you might experience that your heart rate has increased, your blood pressure has increased. Many people become aware of their own heart rate and that we call it as a palpitations. So these are the certain heart related side effects. By the way, heart related, there are two major side effects which can happen, which can be life threatening also. I am going to discuss that very soon. Now let's see what are the side effects can happen on your digestive system. Now what happens due to the hypermetabolic state, you are eating food and that food gets digested. And because it gets digested quickly, you again feel hungry. So that's why after starting this medication, many times people complain that their food habits have increased, their appetite has increased. In spite of eating more, you are still losing weight because whatever food you have eaten, that gets fast metabolized and you are burning that, and that's the reason why you lose weight also. However, please make a note of it that this medicine is not a weight loss medicine. So don't take this medicine unless and until you are supposed to be taking. Otherwise, there are complications which can happen and that can happen on your heart. Right? So that's your digestive system appetite. Now, besides that, many times people complain that they've got some weird kind of a cramps in their abdomen. Sometimes they even have a loose motions or diarrhea, and sometimes even a vomiting can be a side effect. So please make a note of that as well. Now let's see what other side effects can happen on your reproductive system. So especially in the women, after starting the medicine, you might find that there is a change in your periods or change in the menstrual cycle. This medicine can also have an impact on your fertility as well. So please make a note of that and speak to your doctor if this is bothering to you. Now let's see what are the side effects on your bones and your muscles. So on your bones, what can happen if you take this medicine more than the requirement? Then what will happen is that your bones will go into a state of a resorption, and that can make your bone very weak, very fragile and easy to fracture. And this we call it as a fragile fracture. And this condition is called as osteoporosis. Now, osteoporosis is again a very common side effect or very common change which you are going to experience, especially if you are a post-menopausal woman. Once your periods are stopped, once you achieve a postmenopausal zone, then your bones becomes weak and fragile, and that can become more complicated if you take an overdose of your thyroid medicine. That's the reason why we always tell all the patients that please make a note that once in a year minimum you get your thyroid blood test done and talk to your doctor whether do you need any change of medicine or not. Now let's see what are the effects on your muscles. So your muscles can become weak. muscles can lose its strength, and that's why many people experience a tiredness or a weakness in their muscles, and they even feel that the muscles have become flabby. So even that can happen to you. Now let's see what are the side effects can happen on your skin. So after starting this medicine, many people complain that they have got increase in their sweating. Many times, many people have found that their change of their body texture and the skin texture. Sometimes they even find that the skin has changed the sensitivity to heat. And in spite of the chillest temperature in the AC and the fastest speed of the fan, you still feel very hot. And that change in the heat sensitivity can also happen to you. And sometimes women especially have a hot flashes. Now hot flashes can also be a symptom of a postmenopause, so that becomes more severe, especially if you are a postmenopausal woman. Excess of this medicine can also lead you into hair fall. Now please understand, hair fall can be a symptom of a thyroid also, especially if it is uncontrolled, and besides that there are many other reasons for the hair fall also. Protein deficiency, anemia, or nutritional deficiency are just few of them. So make sure that you don't have any of these issues as well. So these are the most common side effects. As I told you earlier, these are usually very mild. Now I'm going to discuss two major complications which can be a life-threatening if not attended on time. And in that, the very first one is a myocardial infarction, in a simple language to call it as a heart attack. Now, what is this? What can happen to you? So if you have any symptoms of the heart attack, like suddenly you find that your chest has paining, or you find that there is a pain on your jaw and the left side of your body, if you find that your blood pressure has increased, or you see that your heart rate is increased, you having palpitations or difficulty in breathing, all of these can indicate to a heart attack. In that case, you have to attend to a doctor or nearby hospital immediately, and a doctor might do a ECG and a test called as a troponin to check what is your condition. Now please understand, these complications are a little less common. However, they can happen, especially if you are taking a wrong dose of the drug, or you are taking the drug which if you are not supposed to be taking. Alright, and now the second major and a complication is a heart failure. Now usually heart failure doesn't happen suddenly. It takes few weeks to few months to develop that. So if you have a heart failure, what can happen to you? You find that you are having a tiredness. You have an extreme tiredness which cannot get relieved. You walk a little bit and you find that you are falling short of your breath. Besides that, you find that your heart rate has changed. That is what we call it as a arrhythmia. There is a change in your blood pressure as well. You find that your body weight has increased, and there is a swelling all over your body, especially over your legs and your ankles, with what we call it as a pedal edema. If you have any of these symptoms, talk to your doctor, and if possible, you can also visit a cardiologist or heart specialist doctor. Now, please understand, the people who have a thyroid problem, they are also at a risk of getting into a heart condition. So it is relatively difficult to say that is it happening because of the medication side effect, or it is happening because of the thyroid coexistent disease. But in any of the situation, you have to make sure that these problem is also addressed. Your doctor might ask you to get your ECG done and few other tests related to your heart, like you can do a 2D echo or a stress test. These are the few testing which your doctor might ask you to do that. Alright, so these are the two major complications can happen. Now let's discuss certain medications which if you take along with your levothyroxine, you need to be careful about. In that, the first drug is the amitriptyline and maprotilene. Now this amitriptyline and maprotilene, they both of them are antidepressant. They are used to treat the depression. Now, thyroid patients have a high risk of getting a depression. So many a times they are prescribed a depression medicine, and sometimes this medication can be a part of your prescription. So if you are taking both these drugs together, then they can have an effect on your blood pressure and on your heart rate. So speak to your doctor. Also, amitriptyline is a drug which is used many a times to the people who have a diabetes and a nerve problem, what we call it as a diabetic neuropathy. So in that condition also amitriptyline is used. So again, you please speak to your doctor. Second class of a drug, that is a albuterol, and another drug called as a pseudoephedrine. Now what is albuterol? Albuterol is a steroid. Now this steroid is used by people who have asthma. It is also used by people who have a lung problem called as a COPD, that is chronic obstructive pulmonary disease. In that condition, this drug is very commonly prescribed. Another drug is a pseudoephedrine. Now the pseudoephedrine is a very common composition, is there in most of the over-the-counter drug which people use it for cough, cold and fever. Now this medicine is basically, it's a decongestant. What it does, it reduces the congestion in your chest and in your nose. So many people take that. So if you are taking these two drugs, albuterol or pseudoephedrine, talk to your doctor because that can also have effect on your heart. Now the third drug is a ketamine. Now the ketamine is actually, it's an anesthetic drug. So this drug is mainly prescribed by the anesthetist doctors. But sometimes people who have an unbearable pain, especially the thyroid cancer people, when they have an unbearable pain, these medicines can be prescribed. And at that time, if you take a levothyroxine, then again it can have a change in your heart rate, what we call it as a arrhythmia. So you can talk to your doctor about it. And the fourth drug, that is a warfarin. Now warfarin is actually, it's a blood thinner. It is prescribed to people who have a heart problem, especially after undergoing a heart surgeries like a bypass surgery. Okay, so at that time many patients are prescribed warfarin. Now warfarin being a blood thinner, it makes your blood very thin, and that's why you have a higher bleeding tendency. At that time, if you take the same dose of the levothyroxine, this bleeding tendency can increase and that can become a life-threatening. So talk to your doctor if you are taking a warfarin and inform your doctor that do I need any change of the dose or not. Alright, so these are the few drugs which can create more side effects if you take it along with the levothyroxine. I am not saying that you need to stop all these drugs, but please inform your doctor so that your doctor is aware and will prescribe the right optimum dose for you so that you develop minimum side effects. As I told you earlier, these side effects are usually mild and temporary. Only sometimes they can become severe and they can be complicated. Don't worry, this medicine is absolutely safe. It is that safe that we use very effectively into small children, even in pregnant women and in old age also. Alright. If after watching this video, if you found any good useful information, please click on the like button and spread some love. If you have not subscribed to my channel, please subscribe. You will get more and more health related information, especially diabetes, thyroid and hormones related information. If you have any question, any doubt pertaining to this drug or related to your thyroid condition, please feel free to write in a comment box. I will try to reply you as early as I can. Thank you for joining me till now, and I wish you best of your best health. We'll meet again in our next video. Till then, namaste.